Now 5:33, and we'll call the meeting to order. Let the record show that we do have a quorum here today. Our next order of business is approval of the meeting minutes. Unfortunately, we do not have a quorum, all individuals present who were present at that meeting. So we postpone the approval. One of our other board. Board of Health, Local Health Department duty reviews. Derek, what do we have?
That's a great question. I didn't get the crash course on what I was supposed to talk to you guys about this. The crash course that I did get was these manuals that we handed out last time.
Yes.
It pretty well just breaks down all of the various things. Do we have 4?
You do.
I have one from last time.
Okay.
Yep.
Basically, this just breaks down what we're supposed to do.
Thank you.
Is Crystal intending on producing some kind of a handbook on this for our department, or do you know the end purpose of this being on the agenda? Or if it's just informative?
My understanding was just that we were supposed to review them, and if there was any discussion or questions or anything, to take down any discussion or questions so that we can get clarification, or so that we can outline things in a more easily understood way.
So we did receive those last meeting. Did everyone have an opportunity to peruse through it and with any feedback for staff?
No.
Because I looked through it, we did get copies last time. It makes sense.
Yeah.
I understand what it's saying. I think some of it is not entirely applicable to us, so we might want to clean that up. That may be her end. I have nothing for you.
Okay.
Further on that matter? Nope.
Nope.
Health First Indiana education updates. Anything beyond the Hancock Health request?
Other than the Hancock Health request.
Okay. This matter is actually old business that we've taken into advisement before. A representative from Hancock Health attended our meeting last time and provided some details on their proposal for the purchase. Again, the dollar value somewhere between $430,000 and $490,000. I'm shooting from memory.
$429,000.
$429,000. So, an investment of some of our Health First money to the tune of that figure to purchase a refurbished recreational vehicle that would be used by us periodically and used also in partnership by
Who owns the bus or the RV?
They own it all.
This will be owned by Hancock Health. They're supposed to undertake depreciation, maintenance, all of those things, gas, obviously. My understanding from the last meeting that we had with them is that it's the 429 split over 2 years, and that's all that we're into it for. They're not going to come back and ask money, supposedly. So that's all that we would be in, and then after that, they're going to take on operational costs, maintenance, and all other fees associated with it, stocking.
So who handles the maintenance in that first 2 years?
It's still going to be Hancock Health.
So they have insurance. I mean, because that's one of the questions I know.
Yeah, the way to think of it is this is like
motor or what happens, if it's down.
This is like seed money, basically, to assist them in purchasing the bus, and in return, we are going to get access to use the bus. I believe 4 days a month.
4 days a month.
So for our investment, we're going to get 4 days a month to use that
2
bus.
years.
Yes.
It wasn't clear to me what happens after the 2 years. I haven't seen any contractor. I know it's early for that, but.
Well, and that's part of what this
ongoing
is.
obligation.
There is no contract in front of us yet. There's nothing to vote on as far as signing on a dotted line or anything like that. This action item would just be voting whether to move forward with exploring it further.
That's fine.
To look at contract terms or, iron out final details before there's a contract produced. As of now, there is no contract. So a vote that would be taken tonight would just be whether or not to move forward with looking at the details and potential contract.
It's 96 days, so we'd have to figure out how many people we can reach for $400,000. That's a lot.
Yeah.
Oh, 429? Okay. Either way, it's a lot.
Well, plus there's, what I got, there was two mobile health budget proposals. One says grand total 2024 through 429,000. Then the next one says this amount not covered by Health First assumes 429,000 over 5 years, 4 community days. Not clear if it's really.
They originally proposed 2. I believe Dr. Sharp had talked to them and requested that they extend that out.
I think when you speak, you're and
I think Dr.
identify yourself because the people in the public would not know who you are.
I am Brittany Cecil, public health nurse here at the Hancock County Health Department. I believe Dr. Sharp requested that they extend that from 2 years to 5 years, if I recall correctly.
Well, and that would enter into calculation of how many days and how many people. But those are all things that can be ironed out in contract documents if you decide to move forward.
Correct me if I'm wrong, Greg, but our final vote really will be to accept the contract as proposed.
Yes.
That's the big green button.
Yeah, there's nothing binding until you do the
Right.
contract, so.
Kind of a fact finding right now.
Other questions? What are the, and I know we don't have two of our staff here today, but what is the collective thought from the staff regarding our benefit of this particular piece of equipment? Is the benefit to us worth it? Can we handle the load? What are some of the concerns, desires of the staff?
So currently we are back down to 2 public health nurses. So at this time, my chronic disease nurses, that position is open. So the one that would be, on the bus, I no longer have that position filled. So that would require pulling me out of the office to be able to staff this bus. But the goal in mind is to be able to help as many public as we can to kind of meet them where they're at. But without the help of Hancock Health and us being able to utilize their provider or their staff on this bus, if they're not going to staff it that way, then I can carry a book bag in my cooler and go to wherever I need to go to be able to meet these people where they're at.
That's a question we don't have an answer to right now, correct?
Correct. I believe
Under our
the,
circumstances.
yes, the original one was we were going to just kind of start this and then they would eventually add a provider if able, which I understand providers are difficult to come by. You know, they can't necessarily guarantee me one, but in order to get things accomplished and moving and people helped, we have to have a provider. Because if not, it's me hopping on a bus and being mobile. I can do that in my car, which I have done for the last 8.5 years. So that is one of my big concerns with it. I do think it could potentially be a good asset for the public. To be able to, access this if, they can't get into the doctor, be able to connect them to an actual provider that they could see on a regular basis and continue to get that care. But in the meantime, kind of filling in that bridge for individuals.
So what all services will we be providing on the,
We could do anything from immunizations to STI testing to TB testing. Cholesterol, A1C checks. We could do like a mental health day. work with, some mental health providers. It could really be as robust as we wanted it to.
Well, that's good to know, because from what I was reading, it really talked about blood pressure screenings. And yeah, that's good to know that
Yeah,
there'd be other.
but that is also contingent on them working with me to be able to
Right.
provide more staff. Because I can do all of those things essentially right now out of my car. Today, I was at the soup kitchen, offered those services to individuals. Later this month, I am scheduled to go out at another place in the county. So we are essentially doing this. This is just trying to build that more robustly and, trying to build that partnership with them.
So, under our circumstances, those 4 days a month would be difficult, if not impossible, under your current circumstances to staff.
Correct.
The $429,000 buys a lot of employees
Yes.
and cars. I don't know.
Without a commitment of a medical clinician, no more than a nurse on wheels, which, like you said, accomplish in a station wagon look back, so.
Any further questions? Not, I'd call the question. Are we ready to take a vote on this, or we need further information? We'll call the question.
I would like to have some commitment from Hancock Health
Information.
to have that they can commit to a clinician, a medical clinician. But it doesn't have to be the same one, just somebody who can write orders, make the medical decisions about testing and things like that.
On our 4 days.
On our 4 days, they need to commit to that. We're
if
going to
not-
commit that kind of,
Is that a nurse, can a nurse practitioner do that?
Yes.
yes.
Again, I'm just going off their budget
Yeah.
proposal, and it says $60,000 per year staffing, 4 clinic days per month, 1 nurse or practitioner if 2 medical assistants. So it's probably that if applicable that causes,
Right, that would have to be more firm.
certainly make sure.
Things we need cleared up. We still don't know whether it's 2 years or 5 years.
Yeah, those 2 things.
So
Unpack
what
there.
I'm hearing, there's a sense that we'd like to hear more, which basically, I
Absolutely.
think at the point we are, we probably have to give a vote. Do we want to move forward with contract discussions, understanding that there's no guarantee? Because that's probably where a lot of what I'm hearing appears to be devil's in the details. That's contract. I mean, or at least
At the end of the day, it's contract.
negotiations prior to the establishment of contract. So it sounds like we might be best to go ahead and vote to move forward with the understanding that we need a lot of information that would probably be more appropriately handled in negotiations.
I would think, I would think that we need more information on exactly what it is we're buying. And I don't understand that at this point. So, I mean, if we're gonna find that in the contract, I would think that needs to be done long before we discuss a contract.
You have 2 options then. You can vote to table it right now and let the staff do that, or you can vote to move forward. And if we can't come up with contract details that suit the board's needs, we can deny it at that point.
Can they provide the contract that they have and let us review that and see if the information's
My
there?
sense, we were going to negotiate that out with staff, and other than maybe a change from a 2-year time limit to a 5-year time limit, I don't think there's been any other negotiation. State.
This has been done before though, correct?
From my understanding, which I don't think I introduced myself, I'm Derek Adams, Environmental Health Specialist for the Hancock. My understanding, having talked to Crystal today, is that there is no contract on the table at the moment. So there are no details as far as what could potentially be in the contract beyond what we've already discussed with their presentation at the last meeting. So my understanding is what we have in front of us now is kind of the information that we have to operate on, and we don't have anything further as far as firm details. It's also my understanding that they're not really playing ball with us real nicely right now, trying to strong arm that agreement, but that, I guess, is neither here nor there.
Oh, I need a motion either to vote on tabling this agenda item, or I need a proposal, I don't think of a motion, thank you, Greg. I will need a motion to move forward with contracting. Clarify that it's pending further.
Well, I would make a motion to further table it for further information. I still don't understand what we get for $429,000 exactly. And before we talk about a contract, I would think that would be the place to start. Now, I read through the packet we had, and it was pretty vague, a lot of the information that was on there. So it'd be nice, I guess, to sit down with those guys and kind of work through what we're talking about here before we, I would make a motion to table it.
Okay, we've got a motion on the table, is there a second?
I second.
Okay, seconded that we table this for further information. All those in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion is tabled. I would ask board members to write down construct an email with your concern and certainly send it to our board distribution packet, including obviously, and that way she'll know the additional information that down with administration and get.
Do you want someone from the hospital or just so staff knows if they make a
I
request?
think that's probably pending how well Crystal can get this information. It might be time to enter a negotiative phase on this thing, which might be a little premature, but obviously the will of the board is to put this on the table until we will know a little bit more about the details that would surface once. And I think as we work our way through that, if we find it's necessary to have a representative of the hospital appear before us in our next meeting. All right, very good, thank you. Is there any other old business? Nope. Okay, so then we have new business, the 2026 budgets.
So going through these, as you guys take a look, all the notes and the margins are basically what Crystal wanted me to communicate with you guys. I'll let you take a look at those and see if you have any questions.
I have the agenda, but I don't have the budget.
I meant to hand you one.
Sorry, I didn't grab my own.
Sorry about that.
Thank you. Sorry to interrupt.
No, that's fine. I was done.
Okay.
I'll gladly be done if you want to keep talking.
I think it's time to look. The first big question, obviously, it's on our minds. We've seen a significant reduction in Health First Indiana money in the state. Is that covered in this budget proposal?
Yes, that is under Health First Indiana here. So the total at the bottom for the 2026 requested budget includes carryover from 24 and 25.
Okay.
Our total disbursement, I don't know what you call it, but what we're getting from the state will be 417, 483. So it's down significantly from what we did get, but we were pretty frugal is a nice way to put the term, was not spending all of our money just on everything. So we've had a pretty decent amount of money left over from 24, 25 to kind of bolster what we have. And
We can continue those goals at least for now.
yes, yes, yes. And in conversations with Crystal, we have 4 health department employees on HFI money, and the money that we're getting now, obviously salaries will come off the top, and anything we have left over will be put towards whatever other initiatives that we enter into or continuing on or whatever. And then she did make a note there. The agreement for the jail navigator, which is currently funded through HFI, is down at the bottom here. It's only through 2026. There's nothing has been agreed upon past 2026. So there may come a point when we talk about potentially extending it, we may just drop it. That's a bridge to cross in the future, but that agreement does only go through 2026, and that's at the bottom of the budget there. And then obviously there are several accounts in here that we no longer receive funding from IDOH for, some donation stuff. And everything else is pretty self-explanatory. Everything that's not written in the margins is pretty well similar to last year.
Questions about the budget proposal? I will entertain a motion to accept it.
So moved.
Okay.
Been moved and seconded that we accept the proposal as presented. Further discussion? Nope, all those in favor, signify by saying aye.
Aye.
Opposed, same sign. Budget is passed.
Deal.
Do we have anything in abstention from Dr. Sharp?
Did you?
Nope.
Nope. Nope.
Okay. How about environmental?
Brent, you want to go first? You got anything? Okay.
Nothing? Derek?
No. Cases that are, pending, big cases or problems that are going on right now. I mean, pretty regular.
How busy are you? Pretty regular?
Kind of on the slow side. I think building has slowed down a lot this year.
Yeah, it has.
I think it has been. I think it's just it's just starting to show more. We're not getting applications, and as we've had in past year, this time, this should be our busiest time, and it's just steady instead of being crazy,
As far as I'm concerned, I've come and talked to you guys a few times before about that nuisance pool that we had over in Cumberland. Been working with Greg really closely. We finally got the order to go ahead and get that pool filled in. That action was completed on June 4th, I believe. So we went out there, we spent about 10 hours out there pumping it down, breaking the insert, filling it with dirt, getting it all graded out and everything. So that has officially been filled in. That's something off of my plate that I could stop thinking about.
Worrying about, yeah.
We're almost to where I can tie that nice little ribbon and put it under the tree. I'm just waiting on the invoice to be paid, and then I'll get that over to Greg so that we can get everything finalized as far as the liens and stuff on the property. But beyond that, that's wrapped up, tied up, ready to go. And then ironically, I got 4 more abandoned house pool complaints right on the tail end of that. So really hoping that doesn't go the same route. Really, really hoping.
You have a process now, anyway. Thanks to both of you for working on that and getting those
Absolutely.
situations
Be
taken
done.
care of. I hope we don't have to continue doing this, but maybe.
We've blazed the path. We know how to get to where we need to get to. Hopefully, if, God willing, we don't have to deal with it again. But if we do, we know the steps to take, and it should be a little less painful next time.
Anything further? Anything what's questions?
My name is Michael Gillam. I'm the other food inspector. I have been asked to propose in Letsy's stead that we go ahead and take the, I've forgotten the word for it, or adopt. We're going to adopt the new 7-26 code, and in the next few weeks, add our own, that's the other word I've forgotten, our county-specific rules to it.
Larger than one recommended by state board now,
Yes, yeah, and then,
or our legislature.
What I recommended to Letsy was that we do the, number one, to adopt the state code, you have, which ultimately, so we need to prepare that, but she had some questions about definitions that may be worded, what we needed to add.
Okay.
And I asked her to get that together. There wouldn't be a vote on adopting the state. I suggested, and I didn't hear back.
Okay.
She may disagree with me, which is fine. She may want to do it as in a step process instead of something, one way or the other.
So your recommendation would be to get those suggestions and wrap them all up in one
That would be
ordinance
my
proposal?
suggestion. So that so the ordinance, there would be one ordinance that would say we incorporate and adopt. Have it all in one section of our code. That was my suggestion.
Okay.
We should have something for you.
Looks like we'll just carry that over to the next business and we'll take a look.
all right, that's it. Thanks.
Brittany, anything from nurse?
Right now, our immunization numbers, they're slightly down compared to what they have been. So we do have several clinics scheduled throughout the summer, trying to continue to get those numbers up for the children. COVID and flu, waiting on guidance from the CDC. Typically, we have that by now. We have flu recommendations from the ACIP, and then the CDC adopts those. We do not have anything for COVID at this time. They are not anticipated to meet until mid-October, which I believe is going to pose a problem. There's nothing we can do about that here, so I would have to wait on state guidance, which they typically wait on the federal guidance. Hopefully they will get that sorted out before respiratory season is upon us. So just know that. Our communicable diseases, pretty average right now. We do have a handful of active TB cases that we are managing at this time, which is obviously increased significantly from years previous. And we recently started STI testing probably the beginning of January. And so those numbers are continuing to increase as well. So that program seems to be going well. And then my only other question is for Greg. I asked the attorney last month or whenever for guidance on lawful citizenship.
Yes.
He didn't have an answer.
I responded back to Crystal, and
Okay,
so we can
go ahead.
go, whenever you're ready, we can go through those other questions. A driver's license and birth certificate document, until they change the law about if you're born here, you're not necessarily a citizen, then that would be sufficient.
Okay.
Have any questions or concerns about that?
I do.
What else do you
So-
want them to present? What else can?
My concern is when I'm out in the field and doing stuff, or even when we're here in the office, when parents bring their children in, they don't have that birth certificate. Like the child's not going to have an ID. Like, so do I just refuse services?
You have access to the state records so that you can look up that child under their name and see if, of course, they may not have been born in Indiana, of course, as well.
Right, so our vital records department, it would have that if they were, born here in Indiana.
Yes.
And then I guess my next question is because in that code or legislation, it doesn't tell us how we have to prove that, or like what documents and how long I have to keep said documents.
Well, the document, as far as retention, there's a retention schedule for all types of
For all,
documents.
okay,
So that's basically, with some exceptions, 10 years.
okay.
Rhonda Cook, who's also of my office and works, she thought the State Board of Accounts was. But at this point, I don't know how treatment, but the fact is it's up or their own for that matter.
Yeah.
As a driver's license, I understand that. Birth certificate. Child, they're going to have to work with you to get that.
Okay. And actually, now that I said that out loud, children might not pose as big a problem because it's only with HFI funds. So for immunizations, that's not with HFI funds currently.
I
But
would suggest
just
we
in
do
the
that
future.
until we receive some other further guidance from.
Okay. Okay, and then nothing else nursing. Nope, nothing else.
Now would probably be a good time, Greg, to answer those questions.
Okay, so from the last meeting, Mike said there was an issue about getting past minutes approved. I'm not sure what the question was, but just in general, minutes can be approved at the next meeting or the meeting at which they're presented, and it can only be voted on by people who were in attendance at that meeting. So I'm not sure if that was the question. It says who can vote to approve and who actually shows up. So I'm guessing that means, and we had this, like tonight, if perhaps, that if we'd had minutes and we didn't have a quorum of the board that was present at that meeting, present at this meeting, then those would just continued on. They still stay your minutes, they're just not.
Because of the increased number of meetings and our board's availability, we're now backlogged. I'm not really sure how many meetings
Yes.
in terms of getting our meetings approved.
Past 4 meetings, we're not able to vote on the minutes at the following meeting.
So do we know who we're missing? I mean.
Like, as of tonight for the last meeting, we're missing Dr. Capen.
Sure.
Other meetings are going to be hit or miss on who was on.
I know it's hard to get board members and they have to have certain skill levels and patience. But again, you just keep them and still your minutes, they just have not get the necessary people here. Maybe you have to have different meetings to try.
Greg, I would ask you, do those meetings stay on ad infinitum or do they drop off at some point?
Minutes, again, under the records retention, you have to keep those at least 10 years. Yes, we do that.
So if we get to 10 years.
Is it mandatory that they be present, that
Yes.
can't remotely vote on?
No,
minute
if
pass?
they came in virtually,
That's what I
they're
mean.
present as far as the law is concerned. There are certain things like tonight. If someone came in virtually, they would not have been able to vote on the budget. They cannot vote on those
On the minutes, they
few
could have.
specified topics. But otherwise, they can participate. And yes, then they could also vote on the minutes.
Or
if
they were present, when they were.
Whether they were
present.
present, or they can vote on the minutes if they're present virtually. So that constitutes being present.
Set up that version.
Yeah, that might work.
They would have to be able to be seen and heard by members of the public as well, now that these have to be.
And I think your IT people can do that. We do this at Greenfield all the time. People come in virtually. Those meetings are live streamed, so.
Put that on a follow-up for target one or two of our next meetings, seeing if we can make a virtual Those are all just checkboxes that need to be checked off. What were the other questions we had?
Well, the other one was about Health First proposal by the hospital, he says. What steps need to be taken to fund the health? That one, does that need to be approved by? That question would be no.
That was my big question.
It's simply a contract that you enter into. As long as you have the money in your budget and appropriated in the proper line item, commissioners by doing that and the council by approving your budget have approved the expenditure of those. So you would not have to take that to. The other one was about a conflict of interest. Able to vote on the Hancock health physician. He would only have to abstain if he was going to be staff the unit.
Okay.
The schedule.
I don't think that's going to happen.
And he doesn't, or if he had any kind of financial interest in that segment of Hancock Health's business operation. So that.
I think that's, in your absence, we generate lots of questions.
That's okay, no problem. That's why we're here. Well, that's why somebody's here anyway. So that's all I had.
Very good. I think those were all the questions.
Okay.
We had. Thank you.
You're welcome.
Appreciate you having that information. Okay, do we have anything from Vital Records or Preparedness?
Report from Vital Records.
Okay, Preparedness?
Hello, my name is Caitlin Dennis. I am Preparedness, and the only thing I have to let you guys know is that I have officially signed 2 MOUs with Eastern Hancock and New Palestine for pod locations, point of distribution sites, and that's all I have.
Thank you. And anything from Crystal Administration?
No report from Crystal, but I was going to use this time just to introduce Ashley Von Guten. She's our intern for 3 days this week and 2 days next week. She's been riding her, let me get out of your way. She's been
Hi, Ashley. Welcome.
learning from the environmental staff a little bit. We were with Kate today, she's showing her the ropes. She's interested in public health policy and or epidemiology. So she came in to spend a little bit of her summer with us just to kind of learn what we do and see how we operate. And she wanted to come tonight and see the policy side and how the board works. So
Thanks for being here and thanks for interning with us. Okay, anything further?
Don't mind if I come up real quick?
Come on up.
Just when
Bertie Nyland with the Hancock County Coroner's Office. I just wanted to make my appearance tonight.
So would you identify yourself and spell your name again?
Oh, I'll speak slow.
That's okay.
Rudy Nyland, elected coroner for Hancock County. And I just wanted to introduce myself to the board tonight. I want to try and get involved a little bit. We work very closely with the vital services with the health department. We problem solve on some of the cases that need to be amended, sometimes on our end, sometimes on physicians' end. And then the staff works very well with us, and we try and get those vital records very quickly. Our office is going to see about 200 cases this year. We have about 5 working deputies on those cases. About 20 to 25% will be accidental deaths. About 5 or 6 of them will be trauma related. Others will be substance issues or overdose type deaths. Probably about 12 to 14 suicides in a year is an average for us, and then a majority of the other cases are natural. One thing we kind of worked with the health department is doing away from pending death certificates, because pending is just kind of a pain for everybody, and it doesn't work. No one accepts a pending death certificate. So what we have been doing is doing what's called a working copy. We're giving them a copy of the death certificate that's been started by the nursing or the funeral home. And then on our end, we'll wait till we get full results. So of the cases that we see, we probably do about 80% signing the cases. About 20% of the primary care doctors will sign the death certificates on a lot of our cases. If it's a natural death, we reach out to the physician first to give them the option to sign. So I just wanted to, like I said, introduce myself to the board. We're going to try and have myself or a representative here. We want to work well with the health department. And like I said, I give Crystal Baker and her staff very good praise because they work well with us. And every now and then we do have an issue that we have to take care of that takes a little bit of time, but we've worked through that and got it taken care of. So.
Yeah, Rudy,
Providing
thanks for
us
the
information.
invitation. Yeah.
Does anybody have any questions for Rudy?
Okay, thank you.
Very much. I
Thank
appreciate it.
you for your service.
Hey, do we have anything else? If not, one more motion, please.
Motion to adjourn?
Move.
Second.
Moved and seconded. All those in favor, signify by saying aye.
Aye.
All the same sign. We stand adjourned. Thank you.
September 9th. All right, nice job.
Your next meeting, pardon me?
No, he's just our attorney.
Yeah, my other element. Notice it goes on and off like a switch.
Ray was Janine Gray.
County